Dear brothers and sisters, Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome to a new episode of Health from Huda TV. Today, we're talking about rash. Rash is something that in children, troublesome, very much seen in the children at the early age especially, and of course, the mothers will be troubled with the red spots scattering all over the body. They all look alike, they all have almost commonly symptoms that the mothers and the parents would not know which problem or which disease are we having here. So today with us is Professor Dr. Ala Al-Musallabi, pediatric consultant at Ahmed Maher Teaching Hospital, Cairo, Egypt, to talk to us about how to differentiate between the different types of rash that affect the children and how to manage these problems. Dr. Ala, thank you for coming today.
Yes, welcome.
And of course, you know more than myself that the parents know about rash and they know the names of the diseases, or most of the names of the disease, but still they don't know which rash is this. Is it just chicken pox or measles? Or we all know the names, but we don't know which one is this. So how do we differentiate between the different types of rash in children?
At first, there's many types of rashes affect children during his life.
Yes.
These depend on the doctor. When the mother say a rash, she comes to the doctor, and by examination, we can diagnose which type of rash affect her child or his child.
Yes.
As you see,
yes.
There's many types of rashes.
Yes.
At first one, what's called chicken pox.
Yes.
It is most common, and you see.
Mm-hmm.
And now there is vaccinations for
yes.
chicken pox, not present in governmental vaccinated centers, but at private doctors and private centers, and begin to vaccinate these viruses after 1 year of life.
Mm-hmm.
And it is important vaccination to avoid the clinical pictures and the features of these types of viruses that affect the child and caused chickenpox.
So what's chickenpox? What causes the chickenpox?
A virus of chickenpox affects children due to contact with an ill disease. Yes. And this appear in the form as seen in the pictures in papular rash. Mm-hmm. Then after 2 or 3 days, the papular rash become vesicles. This vesicle is clear. Mm-hmm. Then after times, 2 or 3 days, this vesicle become dried as seen in the picture.
Yes.
And after 3 or 4 days, these vesicle after dried, they fade off and thrown out, and the child become normal.
To make it more clear for the mothers, what's the difference between a papule and a vesicle? And how would they
as seen in the pictures, the micropapular, it is in raised red area above
yes.
the skin,
yes.
as seen.
Yes.
After sometimes 2 to 3 days, become vesicles,
mm-hmm.
clear vesicles.
So these
vesicle,
are the
it is clear
yes.
vesicle. It is raised above the skin,
yes.
and it can seen by naked eye. It is a vesicles.
Yes.
By the time these vesicles become dried, mm-hmm. And do what's called washed up or thrown out,
yes.
In the form of dried parts, which become brownish in colors.
Yes.
Rather than the vesicles, which it is clear in color.
Yes.
During this rash form, there is symptoms in the form of headaches, cough, running nose,
fever,
the prodromal stage.
Yes.
Then the rash becomes started.
Yes. So, do they get fever, by the way?
Low-grade fevers, about
37.5
to 38 degrees centigrade.
Yes.
Not more than.
Not more than that. So,
yes.
So when the mother finds this, which stage is considered to be infectious to the siblings, to the brothers and sisters?
It is infectious. It's highly
it
infectious.
Is. It is
yes.
highly infectious.
You must avoid contact between her sister or brother till the conditions become improved and the rash become dried and the vesicles go out.
Yes.
after the dried parts become thrown and fall out, the condition becomes subside and no infections after that.
So how long does this take, the whole cycle of the
from
chickenpox?
7 to 10 days.
Yes.
From 7 to 10 days, as you've seen in the pictures.
Yes.
After that,
Yes.
we've seen these pictures.
It affects the whole body, the face and the...
Yes, it starts in the most proper parts, face, trunks, and extremities, little affections by these spots. But at the first, it started in the face and the middle of the trunk, and the extremities are less amount of the spots are present at the extremities, hands and legs.
So what treatment do we give for the chicken pox? Do we give some antibiotics or what?
Oh, no antibiotic at all.
No
It is a
antibiotics.
viral infection.
Yes.
We give symptomatic treatments in form of the lotions in order to help to dry the vesicles and to avoid scratch. We give antihistaminic. That's all, and we give plenty of fluids and bed rest. All will improve the condition of the baby, and after 7 to 10 days, the condition will subside and the baby become well.
So I'm sure mothers would ask, or the parents would ask, would there be any problem afterwards? I mean, some complications from the disease itself?
No complication at all, but we avoid scratchings of the vesicles or babule
They
or
should be very
itchings.
itchy, yes.
And to avoid swimming during this stage of infections, to avoid the vesicles to become wet and too easy to repeat it again and lead it to discomfort of the baby.
Yes. So, and the vesicles would leave some scars, especially if they come, as we've seen in the picture of in the face. Would they give some scars afterwards?
Yes, if the baby can play in it,
Yes.
we can also avoid playing in the vesicles by giving antihistaminic and to avoid it is to playing in the vesicles. So by giving him antihistaminic and bed rest to give a time for healing without any manifestations or complications.
Yes. Among the problems that we are all aware of are the measles.
Yes.
And
yes.
of course, this comes next to the chicken pox, especially that during the vaccination we hear measles and chicken pox and measles. So what's the difference of the features of the measles from the chicken pox that we've talked about?
As you see in the pictures, measles start by temperatures, high temperatures, or malaise, vomiting, bony aches, running nose, redness of the eyes, and the cough, irritating cough. Then after 2 or 3 days from the high fever, the rash will appear. As we've seen in the pictures,
High fever, not unlike the
no,
chicken pox, which is a low-grade fever.
Low-grade fever, high fever.
Yes.
Maybe reach to 40 degrees centigrade.
Yeah.
And at these times, the mother will bring her child to the clinics. We can examine him. We found what's called complex spots. It is spots inside the cheek, which is white in colors, and this is the diagnostics for the measles. And we avoid give antibiotic because it is a viral infections. But we tell the mother give her child more fluids and more sweetie like what's called the juices. And at the same time, if there is bony aches, we give him some of drugs to decrease the pain. And at the same time, we give antihistaminic for running nose. So until the condition becomes subside, and we avoid any contaminations for the food of the baby, and avoid contact with his sister or brothers to avoid reinfections of other family number.
Yes. So when we talk about measles, there is the other one that comes into mind, which is the German measles.
Yes.
What's the difference between the measles as just a disease and the German measles? What's the...
At the same time, but it leads less fevers.
Less fever.
38 to 38.5,
Yes.
not abrupt temperatures or high temperature 40. At the same time, it is come with, as seen in the pictures, in these pictures, there is what's called
Yes.
German measles.
Yes. The measles, the German measles, is also called the rubella because
Yes,
some
rubella,
people would
yes,
use the word
yes,
rubella
yes,
instead of
yes.
German measles.
It is severe infections, and it is accompanied by lymphadenopathy.
Lymphadenopathy is enlargement of the
lymph glands,
lymph glands.
especially cervical lymph nodes
in the neck. Yes.
and the mandibular lymph nodes.
Yes.
And we afraid that it may affect the pancreas and lead to diabetes mellitus. At the same time, maybe affect the testicle and lead to orchitis.
Yes. So it's even more dangerous than the measles.
Yes, yes, yes.
So this needs a very special treatment and a very special care for the patient.
Yes, yes.
How would you do that?
By complete bed rest.
Yes.
And the fluids, and at the same time, if there is progress to bronchitis and pneumonia, we give antibiotic to avoid secondary complications.
Yes.
And at the same time, we give the child vaccinations to avoid this disease.
Yes.
We start the vaccination from the first year of life by give him what's called MMR,
Yes.
which is against rubella, measles, and mumps.
Yes.
And so it is important. And now we give another revaccination after 6 months in order to increase the immunity of the child to avoid get this disease, which it is very severe, and it is affect most of the body systems like the lymph nodes, the pancreas, the testicles, so and ovary in female. So it is avoid this disease by vaccination is better than to get disease.
Yes, definitely, of course. We have a short break that we will be going to, and inshallah we'll be coming back to talk about more disease that would cause rash. Brothers and sisters, please don't go away. We'll be just coming back in shortly. Until then, assalamu alaikum wa rahmatullahi wa barakatuh. Dear brothers and sisters, assalamu alaikum. We're back and we're still talking about rash, and rash in children, of course. And we're still talking to Dr. Ala about the vaccination. Before we went to the short break, you were talking about the vaccination, and I think one of the very important things that the mothers and the parents usually want to know the schedule that they have to take their children to get the vaccine to avoid many of the diseases. Some of them we're talking about, and others that we will be talking about in other different episodes. So what is the usual regimen that the child has to take? Vaccination.
This was called governmental vaccination center, where at the first vaccine, it is what's called against tuberculosis.
Yes.
BCG vaccine.
Yes.
We administrate this vaccine in the left hand, in the upper part, intradermal.
Yes.
And we appear pustules after 40 days from vaccinations.
When does that start? What
we
age?
start in the first days.
First days.
Yes, yes, yes. Second vaccination, it's called DBT, diphtheria, pertussis, and tetanus.
Yes.
And they give in the form of injections in the thigh, half milliliters intramuscular.
Yes. At what age is that?
It starts from 2 months
2
of
months.
life.
Yes.
At the same time, so we give polio vaccine in the form of 2 drops in the mouth.
Of course.
At the same time, we give also what's called the hepatitis B vaccine.
Yes.
In the form of half milliliter intramuscular injection.
Yes.
And repeat this at 4 months and 6 months.
Yes.
And there is revaccinations at 1 year and 3 months.
Yes.
After. At 1 year, we give what's called MMR.
Yes.
Vaccine against measles,
Yes.
rubella, and mumps.
Yes.
And they revaccinate again after 6 months from the first year.
Yes.
There is new vaccinations now, not present in the governmental center.
Mm-hmm.
What's called the rotavirus.
Yes.
It starts from 1.5 months, and they give from 2 to 3 doses
Mm-hmm.
before the child reached to 8 months,
Mm-hmm.
and between each vaccination 2 months at least. At the same time, there is what's a new vaccine, which is called against what's called the pneumococcal infections. It's called Prevenar, and they give from the 2 months, and in the form of 3 doses. Between each dose, 2 months at least, and revaccinate again at 1.5 year.
Pneumococcus is what causes the chest infection.
Chest infections.
Pneumonia.
Yes, lead to otitis media.
Yes.
Lead to
Infection of the
what's called infections, toxemia.
Yes.
Lead also to manifestations of arthritis.
Yes.
So it's given from 2 months,
Yes.
and repeated every 2 months for 3 doses, and the last dose at 1.5 years.
Mm-hmm.
What's called meningococcal infections, it is given from 2 months, and repeat every 2 months for 3 doses, and another dose revaccination after 1.5 year.
A boosting dose.
A boosting dose.
Yes.
It's called what's called Heprex.
Yes.
Chickenpox, as we say, is given in the form of 1 dose at 1 year to 1.5 years, and revaccinate after 2 years.
Yes.
What's called at least meningococcal vaccine. Meningococcal vaccine is given at 2 years, and repeat every 2 years until the child reach to 18 years. It is important to avoid meningococcal infection, which is a severe form of disease which affects the brain and the meninges, and later to catastrophes in children. So it must be vaccinated at 2 years.
Okay.
The last one, influenza virus, as I mentioned before, is given every season according to the types of viruses present at these seasons, and given children from 6 months till above.
Till above. Yes. So one of the back to the rash that I've been talking about, and one of the commonly seen problems or disease is the what's called the scarlet fever.
Yes.
It might not be as commonly known as the chicken pox or the measles, but it is there, and it is causing a problem to many of the children. What is scarlet fever?
Scarlet fever, it is different from measles and German measles. It is due to bacterial infections.
Bacteria. The other ones were viruses.
The other are viruses.
Yes.
Streptococcal infections will affect the throat and tonsils, and they become spread to the skin in the form of papular rash, will scattered all over the body, started from the face to the trunks to the extremities, and this face have a characteristic feature as seen in the pictures.
Yes.
As the infection become more and more severe, we found what's called a white strawberry tongue in order to differentiate from it and from other types like measles or German measles. During the procedures of the infections, the tongue become what's called red strawberry tongue.
Red strawberry, yes.
Red strawberry.
Yes.
Yes. As you've seen, this rash, when we press by hand, fades. This indicate by the doctor it is due to scarlet fever. Other rashes in the measles or German measles not fade.
Yes.
But when I press on the skin, the rash become fade and become white in color. At first it's red, then become white in color.
Yes.
As you see in the pictures, in the hand, this is scarlet fevers, and it is due to severe infection from streptococcal infections. And we see most of the cases there is enlargement of the lymph nodes all over the cervical glands and to mandibular gland lymph nodes.
Yes.
And it is a severe disease, and they need massive antibiotic in different through measles, germinal measles. Most of them are due to viral infection and they need new antibiotics, just reassurance and give plenty of fluid and painkillers until the conditions become good. But this we need a special form of antibiotic in order to contaminate, in order to kill the organism and the condition subside.
Yes. So how infectious it is? I mean, is it like the chicken pox? You have to avoid getting in contact with other siblings?
We avoid. It is infectious, highly infectious. We avoid the contact with the child and they become isolated in the home to avoid transform or transport of the infection. It can be transported by droplet infections, yes, or by sneezing or coughing. All are full by the organism, and they can infect any child in contact with him.
Yes. One of the disease that you've mentioned now during talking about the vaccination is the mumps. I know that mumps doesn't cause rash,
yes,
but it is very common to be in the category of the chicken pox and the German measles, because they all have they get the same vaccination at the same time. So what happens in the mumps? What causes the mumps?
Mumps, it is inflammations of the parotid gland.
The parotid gland,
which is one of the salivary glands, yes, in the body.
Yes. As
you see in the pictures, these are the pictures of the parotid gland infections, yes, in what's called mumps. The condition starts in the form of headaches, colics, running nose, malaise, and after the time, the parotid gland becomes swollen. When you examine the parotid gland, we found that the ear become pushed forward and outward, and the site of parotid gland become enlarged and may extend downward to fill the area under the mandible.
Yes.
At these times, we can diagnose this is mumps or parotid gland inflammation, and by examine the check, as we've seen, we see the opening of the parotid gland become inflamed and red in color. These enhance our diagnosis. By time, we found that from 3 to 6 days, the condition becomes subsides. But at first, it is started in unilateral, and by time become bilateral.
Both sides.
Both sides, yes, become enlarged. What's called buffalo neck.
Yes.
We avoid playing, and the child must be bed rested, and give him many of the fluids, and at the same time we give him antibiotic in order to decrease the temperature. At the same time, we avoid that the infection will be transmitted in the testicles and lead to what's called orchitis. So we avoid playing, and the baby must be bed rested to avoid complications.
I'm sure we have many of the disease, the infectious disease to talk about. Unfortunately, we're out of time, but I'm sure that the viewers have benefited a lot from knowing about many of these commonly seen disease, and knowing about the vaccination schedule as well, which is very important, that the patients should take their children on time to be vaccinated against these diseases and to avoid, inshallah, getting these infections. Dr. Ala, thank you very much for being with us today, and thank you very much for the information that you've been giving us. And brothers and sisters, thank you for being with us today and tuning to the program. I hope it has been helpful and beneficial for all of you. Until next time, we'll be waiting for your emails and your comments. Our email is health@huda.tv, and our Facebook is facebook.com/health.huda.tv. Please join us there and give us your comments and questions. And until next time, inshallah, I wish you a healthy and happy life. Until then, assalamu alaikum wa rahmatullahi wa barakatuh.